Well, hi, this is Lynn, and today is the 13th of September, 2023. We're delighted to be here with Advancing Nurse Coaching. Our webinar today is entitled, What is Nurse Coaching? So it's a chance for us to give a quick overview and then time for questions at the end. So as you are listening, just relax and take it all in like a sponge. If you want to jot down your questions so you can ask later, that'd be a great idea. You can put them in the chat later as well. I know that we have a new way of looking at nursing that hasn't really emerged since 10 years ago. We're actually celebrating the 10th year of nationally board certified nurse coaching. And that certification is through the American Holistic Nurses Certification Corporation. So on the website, it's ahnccc.org. And our school is Advancing Nurse Coaching, which is just two words, nursecoaching.com. So how do those two relate to each other? Our program prepares our nurses to sit for the National Board Certification exam. So the requirements we'll be talking about a little later, but we'll just say that continuing education hours are required as well as practice hours. So those two things. And to begin with, we do always specify that the nurse have experience. So we start there. And I just am thrilled today to introduce my associate director. Now, I'm Lynn McCright, and I'm the director of Advancing Nurse Coaching. My associate director is here with us today as well. Her name is Teresa Walding. Teresa?
Hey, welcome everyone. I'm really glad you're here. I think Lynn set us up nicely. So I'm going to go ahead and start and share my screen and start the slides and go through the slides probably fairly quickly. If it's being too fast, please let me know. I'm happy to slow down to answer your questions. And really, I just want you to kind of get the overview of what we're doing in nursing, and especially as nurse coaches. And we got to find the presentation. Okay, hold on. I thought I had it all set up, but I guess I didn't. There we go. From the beginning. There we go. Can everyone see that? So Lynn's already described to us what is nurse coaching, and it's just really wonderful for us to be here and be able to talk about this subject. It's near and dear to our hearts. So professional nurse coaches, the requirement, like Lynn said, is to be a registered nurse with additional training and expertise, which is the nurse coaching. We follow evidence-based practice, and we help individuals and communities reach their full health potential. Nurse coaches are board certified by the American Holistic Nurses Credentialing Corporation, AHNCC. It is really your guide to everything you want to know about nurse coaching. There's a whole tab on that website that gives you a lot of information as well as resources. The board certification is Magnet and Pathways recognized, and it applies to every clinical situation, not just a specialty, but overarching all nursing practice. So you can practice nurse coaching in any setting where you find yourself as a nurse. We help patients in all kinds of different ways to navigate chronic conditions, illnesses, even aging, death, and dying, health maintenance, and more importantly, most recently, in prevention. When we are able to begin to help people to really access the innate health within them and show people we're not just a diagnosis, which, the patient knows that. But we really do, in the medical model, focus on that. And nurse coaching is bringing back the essence of nursing.
And we have a lot of people who actually focus on healthcare providers themselves. So not only are we coaching our clients, we're coaching our colleagues as well.
Yes, yes. So nurse coaching is about building relationships. It's really holding this space for a patient with the skills that a nurse coach has, which is bringing presence, attention, engaging with someone with nothing on your mind except for to hear at that deeper level about what the patient is saying and not saying. We bring this to the conversation so that the patient can identify their own goals, and we help them find their own answers. It is not prescriptive. It's not dictative. It's, listen, this is your life. How would you like to achieve your goals? And with our nursing education and knowledge and our ability to really deeply understand and care about people, bring this conversation to them. It empowers people to really take the reins in their own health and gives them a direction to follow. In the way that we coach with advancing nurse coaching, we're actually looking at root causes. Where does the experience of life, not just this disease or dis-ease as it may be, but how do we truly create the experiences of our life? Lynn, would you mind muting people? So understanding the root cause truly is where healing begins and ends. When we understand this integrated mind, body, spirit way of looking at life that has never been separated, we now can help people to engage in life, engage in the things that create health and really truly joy of life. So nurse coaches, as I was just talking about, are excellent listeners. And I think most nurses think we're good listeners, but we were just talking with one of our former students, amazing coach. And she does some per diem still at the clinic where she used to work. And she was taking care of a patient in there one day, and he was very upset. He had a lot of things on his mind. He was terrified of the procedure, and he was not a pleasant person in the waiting room. And she said, tell me a little bit about what's going on with you. And he was telling her about all the things that he was worried about, what had happened prior to him coming to this appointment, the fact that this was a second appointment because the first one was inconclusive. And she said for about 10 minutes, she heard things from him and listened to him at such a profound level that she had never experienced before. That's what nursing and nurse coaching brings to the conversation. And you can drop into that space very quickly. Once you know what that feels like, it's where you want to live when you're engaging with your clients. So, and uncovering those insights to gain clarity allowed her to help him calm himself down in the moment, and imparted on him the safety and security of a staff that was really engaged in his care. And the procedure went very smoothly, and so did the recovery. So it's one of those skills that you can use anywhere. That's a very small example. But when you bring that presence to the client and slow down the conversation in our busy world, we will hear things we haven't heard before.
Well, and Teresa, it was remarkable. Didn't she tell us also that the gentleman came back later and apologized for his rude behavior in the way? I mean, that's unheard of for a client to actually take that extra time to appreciate the staff. It was just,
yeah. And I know we all have stories about that, but I think this coaching skill really shines the light. Like, no, this is what nurses do. it's bringing the essence of nursing back to nursing.
Especially when these times are so often heralded as violent times. And for us to be able to appreciate our clients who recognize their own behavior as being an important part of that relationship.
One of the questions we get all the time is, so where do you work as a nurse coach? As you can imagine, hospitals, a lot of nurses are going into their own private coaching practice, case management, private businesses and insurance companies. Truly the possibilities are limitless. I talked to a nurse coach who created her own position within her hospital to coach her peers. I met a woman who, before she graduated her nursing coaching program, not ours, but she met someone and was so excited about nurse coaching. She's like, I want to just take my nurse coaching into businesses where I can help your people. And before she graduated, she actually got a contract coaching the employees of a construction company to be part of their employee benefits. And when it came time to cut the budget, everyone at the table said, nope, we're not cutting nurse coaching. And she's gone on to go to 2 or 3 more companies now as a nurse coach, offering services to help individuals show up better in their own life, which, as you can imagine, increases the company's bottom line, relationships within the businesses or units, wherever we work. If you can imagine it, you can do it as a nurse coach.
And she hires other nurses to be her peers
Coaches.
if she has extra work for them to do.
That's right.
She's an employer herself.
Yes. And I think we're going to see a lot of nurses begin to do that as we tap into the places where nurses can really do service to the public. So how do you get started? You must be a registered nurse. If you have a 2-year degree, an ADN degree, you have to have 4 years of experience. With a bachelor's degree or above, you need 2 years of experience. And one of the questions that we get is, well, if I haven't graduated college yet, can I still do it? Yes, you can. Once you graduate, you have 3 years to gain experience and use the continuing education credits. The 60 hours of CE and supervised coaching hours are available for 3 years. They must be used to sit for the board certification within 3 years. We hope most people won't take that long, but I'd like to let people know that that is available, because we want our younger nurses to come into nurse coaching at the beginning of their career. I think it will help us with collegiality, with retention, and with just building our community of nurses and showing really what we can do. Anything to add, Lynn?
No, I think that's good.
Okay. So at Advancing Nurse Coaching, we do offer the 60 CEs that are required and the 60 hours of supervised coaching practice. We are 100% online and self-paced with rolling enrollment, which means you can start at any time. The coursework is very experiential. The first 2 courses are truly designed for you to tap into this inner space where all healing and health resides. Because from there, that's where we know that we can have the most impact. There's really nothing to add to someone's life experience except for however they want to interact with life. I can't say that right, Lynn. Say that. Say that for me. That didn't come out right.
Just say it again, Teresa.
I want people to know that there is a way to engage in life that doesn't require you to add a bunch of modalities or extra things on your plate to do, take extra time out of your day to be able to live life full out. When we understand how our mental life works, how our minds, bodies, and spirits are all one thing, living a human life, we now have a guidepost, or even we can call it a runway to aim for, to be able to navigate life more easily. And it's about the way that humans function psychologically, because we live in a thought created world. And pointing people to this one way of experience gives us something we can count on every single day to help us in any circumstance we might find ourselves in. And those are we call them the three principles. The three principles, as the foundation, helps people to live in the present moment, learn through logic and insight, because we don't really learn anything unless it makes sense to us. But when it makes sense to us, we must have insight to bring it to action. And realizing that every single human being is using these same principles. And the principles, we call them mind, consciousness, and thought. And there's some definitions on our website and different places where you can find that. But it's really the way we are designed, that we get to use all of our senses, all of our ways of knowing, to live life. And it's the innate health within us, this place that we come from, that does the healing for us. But we do get to experience all of the aspects of life, and helping people realize that there's nothing wrong actually takes a lot of things off our mind and puts a body into a state of health. It's really like, for me, it was the most pivotal moment in my life to realize the truth of that. I was at a conference experiencing burnout, experiencing a lot of what I called family problems, but really just the immense amount of worry and stress from just life. I did not know how much of a role my thinking about those circumstances was impacting my health and my relationships, and truly everything about my life. And insight into that being self-created, that being personal thought created, rocked my world. I'd had chronic pain for 5 years, and that disappeared in the middle of the conference. And this coaching program was born out of that moment of realization that it really is that simple. This awareness of innate health and the built-in resilience in us all is truly worth exploring. Because with nurse coaching, understanding where we're coming from, understanding our experience of life, naturally, without effort, improves collegiality, decreases our personal reactivity. You know, that breath before you respond to something, when you know that it's you creating the meaning to those responses, we get an opportunity to do it better. When we impart this knowledge, we empower our patients. We bridge gaps in care because people become engaged in their care, and we create better outcomes. And when people are more engaged, they're more accountable, they're healthier, they see hope, and there's an ability for us to really improve lives simply through an insight into why you should or shouldn't do something. And a nurse coach holding that space for someone is the most empowering place you can be. And it is 100% transformation for that individual.
Well, and any time that we experience an insight, it is lifelong. So this is lifelong learning. Sometimes we might forget it, but it'll come back again. And we have never really had in our educational system a recognition and an appreciation for the kind of insight that we're talking about today. as the most important way for human beings to learn how to move forward in their lives and how to take the next step. It has to be completely unique to each individual. Us standing over our client, shaking our finger, saying, "You've got to do this," has never really worked. And when they see it for themselves, they will know which step to take next.
Yeah. So with this, the CEs that we offer at Advancing Nurse Coaching, you can become double board certified through HNCC as a nurse coach and a holistic nurse. If you take all 4 of our courses, C101 through 104, you are eligible to receive the Advancing Holistic Health Coach certificate that we do offer for completion of our course. And in our coursework, we actually offer a way for people to stay connected through our advanced course or mastermind group, where we continue the conversation, help people to have a place to ask questions, bring their coaching questions to the group, get peer support, and really developing a community of nurses who want to look in this direction to help our society heal. Nurses have been called to a higher action to create health and healing in our society.
Right.
I
So,
can't want to be anywhere else.
but let's talk about the certifications for a minute. These are mix and match. If you would like to be double board certified, you're certainly welcome to do so. You could choose to do one or the other. In fact, all 3 of these are entirely optional. You can do them all at the same time. That's why they're all on the same slide. But if you choose to, you could only do 1 or 2 or all 3. And let's talk for a minute, Teresa, about that legal requirement in regard to nurse. Nurse is the first word in nurse coach. As such, you are under the jurisdiction of your licensing agent, which is your state license. Some people are in compact states, so they can work in any number of states. Texans can work in 26 states. People in California can work in California. If you're an advanced practice nurse, you can work only in the states where you are licensed. So there is no compact licensure for advanced practice at the moment. So any further clarification there about nurse being the most important part of nurse?
Yes. So, and that said, with your licensure, you can practice as a nurse to the nurse and nurse coach to the top of your licensure in your state. It's knowing how to stay in your lane as a nurse, which is, if you have an active license, you cannot not be a nurse. Some people, I know there's some misinformation out there that, well, I'm just not going to practice as a nurse, so I can practice in all the states. If you have an active license, you are bound by that license. So if you have more questions on that, I'm happy to answer questions because it's a big topic. And then staying in your lane. That's why we have scope and standards of practice. As the scope and standards of practice for nurse coaching is called The Art and Science of Nurse Coaching, the Provider's Guide to Scopes and Standards.
That's our book. That's our
book. And then there's the scopes and standards of your nursing practice. And so you have to know what those are just to keep yourself safe. The other thing is, as a nurse coach, and I highly recommend it, is to have your own malpractice insurance. It's just another level of protection. And I personally have NSO, National Service Organization. I've heard many of their presentations, and I think they're really, really good. So it's just a couple of logistics. They come up quite often as questions that what are the limitations as a nurse coach? And it truly is.
Yeah. And we're so new. Basically what it is to say is that practice precedes law by about 10 years. So we're right at that 10-year mark now. No nurse coach has ever been brought before a court of law. That has not happened.
Okay. I just love this picture because it demonstrates to me that we're planting seeds. We're really coming together as a profession, as nurse coaches, to shine the light on what nurses do. We've had trouble in the past letting the public know, letting employers really know what nurses do. And nurse coaching, in my opinion, is shining the light on that. It's bringing all of our knowledge from everywhere we've ever worked, every doctor we've ever worked with, every patient we've ever worked with. We bring all of that knowledge with us. Our education, the knowledge of the human body, of interprofessional, interpersonal skills, and the healing process. What does it look like? And what does it include besides the dressing changes or the treatments that we're giving? It's nurturing the human spirit. Nurses know how to do that. And nurse coaching shines the light on those skills. And so we can begin to really talk about it in a way that our public will resonate. Like, I want to know what a nurse coach does, and I would like to have them coach me. And truly bringing nursing back to the community where we really started. So there's no time like the present. Indeed, it's all we've ever had. We are Lynn and Teresa. Contact us at nursecoaching.com if you're watching this after this webinar. We are happy to speak with you, just to help you get clear if this is the right path for you. No obligation at all. We just want to bring what nurses are doing to the front, and we want you to be part of that conversation.
And let me say that our coursework is a rolling enrollment, so you're welcome to join us anytime. And we also are completely self-paced. So you do it at your own rate. If life intervenes, you can come back later and pick up where you left off.
Thank you very much. I'm open for conversations. A couple of questions. Wendy, thanks for this. Great job. I will continue to think on this. Blessings. So Wendy, hi. Hey, Brooklyn, welcome.
Thank you. So I actually already enrolled, I think, day before yesterday. I haven't done my
Yes,
first.
you did. We saw you come through.
I'm curious, is there any portion that is more like maternal, like mother baby, maybe postpartum in there?
You know, the interesting thing about our program is it doesn't matter your specialty. We're talking about root causes because everyone has a different interest in where they work.
Right.
But the one piece that we've all been missing, that I was missing when I did, decided to go to that conference, what I left out of that story was that Friday when I left work to go to the conference, I was going to put my resignation in on Monday.
Oh, wow.
Because I was tired. Mm-hmm. I was exhausted. I was, I guess, disillusioned. I thought that if nursing is going to be like this, I don't want to do it. Right. And I didn't know what else I was going to do, but I knew it wasn't that. And so learning how my mind works and all of the extra thinking I had been having about my life, my work, really wasn't aimed at anyone else. It was just like I hit my wall. Yeah. And I was tired. And then I heard about separate realities, that no one can think like me. And I had to own my own thinking about life and my work. And I heard something in presentation, which is what we talk about in our coursework, that just touched me to my core. Like, oh my gosh, this is what's been going on my whole life. And I didn't know it. How is that possible? Because we are it. Yeah. We just live. Monday morning, I had a new job.
Wow.
I didn't go anywhere. I didn't do anything. And I could see how it applied to everything I'd ever done. And I've worked in a lot of places. I worked pediatric home health. The only maternal child I had was I have recovered a lot of C-sections, a lot. And that's a very special, unique area. And I used this skill on all the recoveries that I did. I worked post-anesthesia recovery for about 20 years.
Oh, wow.
And I loved every moment of it because I got to see everyone. So I hope that answers your question, but you will see that this is really truly life in perfect motion. The ability to understand this thought bridge, as we call it, that creates life. And that thought bridge only works one way. And that's what guides us no matter what we do.
Thanks so much, Brooke. We'll see you tonight.
Thank you. Appreciate it.
You're welcome.
Well, Therese, your little box keeps lighting up, so I'm thinking you have a question for us. You're welcome to go ahead and ask.
Well, my question, my box kept going in and out, but my question consists of, I actually learned about this at a conference when I went in Houston on innovations, and I'm finishing up my DMP. So I saw that this is a program that you're working on, and I want to finish my DNP first. And someone had reached out to me from your actual program, and I told them I wanted to finish the DNP, which hopefully, knock on wood, will be this month, no later than mid-October, and then get started on this because I've done some mentoring for the ANA, and I'm going to actually take on a new role at a university. Non-public one as an RN mentor and nurse coach, and I think it coincides.
We
Yeah.
actually teach our program at the DNP program at Texas Wesleyan University.
Okay.
Yeah, so we have a foot in both camps. We're both in academia and in our own privately owned school. And
Okay.
I think what I want to say about that is just that it applies to, well, as Teresa has said, to all nurses everywhere, every educational level. And we often find ourselves coaching our colleagues as well as our clients. So what can I say? We just feel like this is the perfect place to be for all of us now. And congratulations on your near completion of your program. How wonderful is that?
Thank you. Yeah, I'm ready to be done. It's been a interesting 3 years because I also did travel nurse leadership while I was doing the program.
A lot of people have told us that it's this program, our program in resilience, that has gotten them through their academic program. So welcome. We're eager for you to complete what you're doing now and join us as soon as possible.
Well, thank you.
Oh, you're more than welcome. Thank you for being here with us today.
Well, Tyson, was there anything that you were curious about or had a question about?
No, not really. I actually am a nurse coach, and I've been in the three principals for about, well, I guess it's been close to 2 years now.
Okay.
And I always get kind of inspired when I hear these things to see what direction I want to go.
Right.
When I first started with my nurse coaching certification, it was right after COVID. I've only been a nurse for about 4 years. And so I was like immersed in all the COVID stuff, and I was like, this is not for me, and was trying to run away from nursing actually. And I just started a new position at a different hospital in mental health, and I absolutely love it. And I haven't really started a coaching practice per se, but and I don't know where I'm going to take it, but I just know that the opportunities are really endless, and it feels better to not be running away from something and going towards towards something. So
Oh, I hear you. I know. It's like
yeah.
when you find the direction, it's exciting. Like,
Yeah, yeah.
Okay, I can do this. I'm okay. I'm gonna be okay.
Yes. Yep. Yeah. Yeah.
And that space opens up for us to get creative and dream. And we all had a dream when we went into nursing, like what we thought it would be like.
Right.
And for me, graduating a long time ago, it really was. But progressively over time, as we got more and more technology and better equipment, and we lost something. We lost the essence of nursing in the tasks. I read somewhere, I was reading, nurses in a 12-hour shift have 660 tasks to do. That doesn't leave much time for other things like taking care of our patient. And I think we do, even in that environment, I think we do a really good job.
Oh, definitely.
But I
Yeah.
want more space. I want people to know that they're going to be okay.
Yeah.
That we don't even have to think of healthcare as sick care. That's
Mhm.
that's how I think we look at it now. Well, oh, I'm sick. I better go get a pill, or I better go, to the doctor, or, what does health look like? I don't even think we know.
I think you're absolutely right. We don't know. The general public doesn't know. Yeah.
Yeah. So I think helping people to see that, and I think as the three principles becomes more well known in the healthcare community,
Hmm.
we're going to see a huge shift. A huge shift. It has to, because when the first person that sees it is ourselves.
Hmm.
We are different people when that connection happens, for us in this context.
Yeah. And that's one big thing that I've seen is that I don't really necessarily yet need to go teach the principles per se, but just living them
Yeah.
spreads them. Absolutely. I had a patient last night. I work on a locked mental health unit, and she's there for an eating disorder, and people would just throw the food away in her room because she's limited. And I brought her in there and I showed her what I saw and said, you're not supposed to have all this in here. What would you like removed? And she was so appreciative that I took the time to, take her in there and give her options. And I just think, treating people like humans and, seeing their innate health and they have their own wisdom when we can kind of foster that and let it come out instead of thinking we have the answers for them all the time. And that's just a tiny example, but
That's a
it's
huge example, because those are everywhere.
yeah.
Oh, I love that example. I might have to use it. Can I use it?
Oh, for sure. Yeah. Yeah.
Because sometimes it's when we point to those kinds of things and we don't really give them the credit that
Mm,
they deserve,
yeah.
right?
Hmm.
Because again, we're nurses and we just do it.
Yes. Yeah. Yeah.
So good for you.
Yeah.
Shine your light. Let people know, because it's important to be that beacon of hope and healing, truly, for others.
Yeah. Yeah. And I made sure to pass that along and report too, what
Good
I
for
had
you.
done.
Oh, that's
Yeah.
great. Oh, great.
Yeah, yeah.
No, I kind of timid about speaking up about things, but I'm done being that way.
No, because you know what the interesting thing is that I've learned through all this coaching with all of the nurses that we talk to, they don't even know how great they are. We don't even know how much we know. It's
Yeah.
just normal
Yeah.
to us, but it is
Mhm.
profound to people who have never heard it.
Yeah.
My daughter is kind of one of the people that shines a light on that for me. She's like, when I start talking about things like, the principles, or health, or being sick, or whatever, and she goes, well, I'm sick today, but I guess I'll get over it. I guess I'll know when I need to go to the doctor or something like that. And they're like, how do you know that? That was a
Yeah.
conversation she actually had with one of her coworkers about a month ago. She's like, you don't think about life the same like I do. I worry about everything. And she goes, well, my mom's a nurse, so sometimes I tell her I'm broken because I just know things that other people don't. And I said, no, you're not broken. You just have a different way of looking at life. So
Yeah.
I thought that was funny.
Well, and Tyson, congratulations on your board certification.
Yeah,
I'm
great.
to meet you. Wha-
Thank you.
One
Yeah.
of that people tell us is that we have what's missing in all of the other programs. So the count starts over once you're board certified. You start accumulating CEs for your next certification. So consider that option.
Yeah, sure. Thanks, Lynn.
I know 100 is a lot in 5 years because it's kind of like, oh, I have to be actively engaged, which is part of being a nurse coach, is you are engaged in continuing education.
Which is my favorite. I love it. I just got to spend the weekend, well, not just, I guess it's been about a month now, but 3 days with the Pettits in Iowa.
Wonderful.
We did
Yeah.
too. I was on Zoom.
Oh, were you?
Yeah,
Yeah,
it was wonderful. Just wonderful. I offered the CEs, so be sure to pick up on those.
Yes, I requested them, but I haven't. That'll get figured out. But yes, thank you.
Great. Great.
And I just joined the Minnesota Holistic Nurses Association, and
Good.
there's another nurse coach there, and there's a couple of people asking about the program. So I always refer. I didn't do your program. I didn't know about it at the time, but I always refer people to your program since it is principles based.
Oh yeah. Yeah. Oh, wonderful. If you want to just jot your email into the chat, I'll send you the link for those CEs.
Oh, okay, thanks.
Yeah. Well, Sophia Marie, I see that you're unmuted. We would love to have your question.
No microphone.
Okay. And SOOS, SOOS.
Seuss?
Yeah, I don't know exactly what that is. I looked it up. It could be 3 different things, but we would love to hear from you today.
From Greenland. Wow. Wonderful.
Marvelous.
Oh,
We have,
Seuss was the one that said that they had no microphone.
oh, okay. Well, we do have students in Europe and specifically in Scandinavia right now. We also have students in Canada. We happen to be interprofessional, so our Canadian counterparts are actually an audiologist and a speech therapist. So it's really fun to have an interprofessional group in our coaching. I think it offers a deeper dimension of our healthcare as we work with other professionals, and that's a special treat that our course offers. Not all courses offer for other licensed health professionals, but we do.
So, Seuss, did you have any questions at all that you can type into the chat if you would like? We're happy to answer them. And while you're thinking about that and typing, Charisse, do you have any question you'd like to ask?
Comments, questions, puzzlements, insights. There we go. Insights. That would be wonderful.
This is Sharice. I have no further questions.
Okay,
Okay,
good.
Just
Okay.
best wishes on your studies, Therese. Sounds like you're really there for all the nurses in the world, and I just really applaud the love that you're sharing with each of each of the areas that you're working in professionally.
Well, thank you. I'm working on that. And just like the other one said, certification, I actually sit for my NEABC on the 30th of this month. So I keep myself busy.
Man, I guess you do. Wow. Wow.
Nothing but well-rounded. Sounds.
Yeah.
We're going to be speaking at the American Public Health Association conference in Atlanta in November. So we're excited about presenting to the public health nurses.
Okay.
Our topic is resilience, and we're also going to be presenting a research survey that we did for nurse practitioners when I was at the American Academy of Nurse Practitioners. 65% of them said that they wanted to become nurse coaches, and
Okay.
60% said they wanted to become certified holistic nurses. So I was really thrilled with those results. I had done a preliminary survey with my own group locally, and 30% had said that they would be interested. So when I went to the national meeting and 60% and 65% said they were interested, I was just astounded. Double the numbers of my local group. And I was absolutely thrilled. So we will be presenting that as well.
Well, great. Congratulations. I really think it is very needed. Nurse coaches and nurse mentors. When I started my career decades ago, I refused to call myself the old nurse, the seasoned nurse, experienced nurse. Uh, um, I wish something like this had been around. It would have been a little bit easier and given me a little bit more insight into what was actually available as you continued and progressed in your career.
You know, I really have had the best of both worlds. I started my own private practice in 1986, so more than 30 years ago. And
Mhm.
I had found out about the life-changing thought thread that we're discussing here today, but I hadn't found it either in any form that I could adopt. So I started uh, my own private practice. I mean, in a way, I kind of invented nurse coaching before we invented nurse coaching. And I called myself a nurse consultant, but I was doing then exactly what I'm doing today, sharing all throughout the community about resilience. And it, not that it's about me, because it's not, but I'm saying if I could do it then, it can be done again now. I worked with nursing home. I worked with an outpatient mental health center, um, a large industrial firm that was having on-site job accidents. I worked with local community clubs like Kiwanis and the Chamber of Commerce. I taught at the community college. I did a research project there. I had my own private patients in my private office. So I just embrace the entire community. My background is public health, so the community is my client. And I saw this coming 30 years ago. So it's been a long, I can't even begin to say the joy that I feel in the opportunity now to share this, because um, when we saw nurse coaching and resilience principles together at the conference Teresa mentioned, that already put us 30 years ahead of where we are today in our profession. And so I was 30 years ahead then. I'm 30 years ahead now. I
Yeah.
just am so thrilled to be sharing this and delighted to have you with us, and eager to move to the next level.
Well, thank you for sharing. It's very innovative, which is, what we're focusing on now as nurses is innovation and how we can do to improve and make things better, especially for the next generation as they come up. That's my main focus, making sure they remain patient-centered.
Population health, that it has to be throughout the community, all of the different levels of society, all of the different ethnic and cultural groups, all of the different areas where we find not just the public, but nurses. Wherever we find the public, there we find the nurses too.
Yes.
And in my book, everybody either is a nurse, knows a nurse, or has a nurse. So,
Very true.
I recently attended a National Black Nurses meeting, and I know that they were talking about people who were incarcerated and the nurses that work in those settings. And somehow I had never even really thought about that, but they do such wonderful work there. And in fact, there was actually a research project done in England. There were two prisons side by side, and all that they shared was a common fence, just an open link fence between the two exercise yards. At any rate, one prison was to be the control group for the other And the first prison was learning about resilience, the principles of resilience. Well, guess what? Somehow through that open link fence, the word got over to the people in the other prison about resilience. And suddenly the control group disappeared. So they had to find another prison somewhere farther out that the information couldn't be leaked to.
Okay.
It's such a joy to share your own natural resilience with people. They just will not be contained,
That's very good.
isn't it? It was just so inspiring when I heard that the first time.
Well, thank you again.
Oh,
Good.
we're really glad you're here. We look forward to having you in class. Our goal really is to have a resilience principles nurse in every place a nurse is.
Well, and starting with the very first course in every school of nursing in the land. I mean, for them to be able to have the background of understanding their own resilience, we're going to be totally burnout proof. When we nourish ourselves as we're working, there's no way for us to get burned out. We may decide to change jobs, but we're not going to be suffering. It's just such a relief to know that inside every human being is perfect health. And as the medical model is today, all we're looking for are the problems. When we turn that around 180 degrees and begin to look at the natural health that every human being has within them, our healthcare system will change completely.
And it's the most fun I've ever had as a nurse. I mean, like I wake up every day and I am excited to get to talk to everyone. You know, all the people that come into my calendar, I thrill at everyone because I know lives are changing and it's important work.
I'm not sure. Does Sophia Marie have a mic?
I just saw the microphone go off. Was that intentional, Sophia Marie?
The mic is still on.
Yeah.
Yeah.
It's okay. All right, I think we're at time, Lynn, if we want to go ahead and close.
Oh, I just want to thank each of you again for joining us today and wish all of you the best luck in your future endeavors. And from the bottom of our hearts to thank you for choosing nursing as your profession. Have a wonderful day. Thanks.
Yeah.
Bye for now.
Bye-bye.